DW Africa Link.
Ebola is still spreading inside the Democratic Republic of the Congo, and there are growing fears that the Bundibugyo strain of the virus behind this outbreak could spread across the borders of East Africa. In fact, Uganda has joined Rwanda in closing its borders to the DRC, which violates World Health Organization guidelines. So can this Ebola outbreak be contained? That's what's coming up. I am Eddie Micah Jr., and you are welcome to Africa Link, the podcast connecting you to the stories that matter.
Africa Link, every weekday here on DW.
The World Health Organization has warned of a very high risk of the rare Bundibugyo strain of Ebola spreading across the DRC, and that's especially worrying because there are no approved vaccines or treatments for this strain. More than 1,000 suspected cases and over 200 suspected deaths have already been reported, and the numbers are expected to rise. The outbreak was confirmed weeks late, while ongoing conflict in eastern Congo, mass displacement, and poor infrastructure are making the response even harder. WHO Director General Therese has called for a ceasefire to allow health workers safe access, warning that attacks on medical facilities are making it nearly impossible to track cases and contacts. My colleague Michael Okwu spoke with the DRC's Foreign Minister, Therese Kayikwamba Wagner. She starts by explaining why it is so difficult to control the outbreak of Ebola in the Rwanda-backed M23 controlled areas.
Well, I think this shows us to what extent this is an issue that converges, unfortunately, with security dynamics. What is very important now when we're faced with a disease such as Ebola is the capacity to respond fast, to have the trust of communities. And this shows us to what extent the M23 and Rwanda, because it's important to emphasize that the areas we're speaking of are not just occupied by the M23 rebellion, they're occupied by Rwanda and the Rwandan army. It is difficult to envisage sustainable and successful emergency response in areas that are occupied by foreign forces. This is why the Congolese government insists on the fact that more than ever, Rwanda needs to withdraw out of the DRC in order to enable the Congolese state to resume its presence, but also to provide the direly needed humanitarian assistance and healthcare that is necessary in these areas in order to prevent any further spread of the disease. I think in any conflict situation, what normally has to prevail is international humanitarian law. It is the law that governs us even in moments of conflict. Unfortunately, we have seen over the months and years that Rwanda has no respect whatsoever for that. But this situation is shedding a different light on the overarching dynamics. And I think it is an imperative now for us to make sure that the access is given back to the Congolese government in order for us to avoid any catastrophe and further spread of the disease.
Minister, I want to make sure that I'm hearing you correctly. Are you saying that in order to properly contain this emergency, deal with this emergency in the eastern part of your country, it is contingent on Rwanda's removing themselves from that space?
Of course. Rwanda has no interest whatsoever in preserving Congolese lives. We have seen that over the past years.
So the disease could run, I'm sorry to interrupt you, but I want to make sure that the audience is clear on this. The disease could run rampant in that part of the country. You're suggesting,
of course,
if your combatants maintain their presence there.
Of course. And in addition to that, set aside the fact that Rwanda has no respect whatsoever for Congolese lives and no interest to preserve them. You add to that their proxy, their M23, that is, setting up the semblance of a parallel administration, but has no experience whatsoever in running an emergency public health response. So these are the ingredients. In addition to that, of course, all the other challenges that we have seen in other parts of the country, these are the ingredients for a catastrophic further evolution of the disease in these areas. And that's why it is imperative, it is a public health imperative that Rwanda and the M23 withdraw from these areas, and that the control of the situation is handed over to entities that A, have the mandate to do so, and B, have the experience and expertise to do so.
I understand that these are your combatants, but given the severe severe case here, the fact that you have a virus, a highly contagious virus that could kill hundreds, if not thousands, of people. Is there any effort on the DRC side to work with your enemies here, with the M23 as well as the Rwandan government, to start effectively dealing with the public health emergency?
Well, the issue here is, what can we expect from the M23? When you speak of working with them, are we going to train them on how to run a health emergency response? I don't think so. Rwanda denies the fact that it is present in the DRC. So obviously they are not going to play an active role. We find ourselves in a situation where one side of the equation, Rwanda, being unwilling because it would be confirming their presence, and the other side of the equation, the M23, is unable because they do not have the expertise. Now, in a situation of such a magnitude, the imperative is to save lives. The imperative is not to satisfy the political appetite of Kigali or the political appetite of the M23. We are talking about hundreds of thousands of human lives that are now on the line. And this is a moral imperative. And I think it is important now for all stakeholders to acknowledge the extent of responsibility they're willing to bear in light of such an impending catastrophe. For the Congolese government, it is clear that the Rwandan government has no intention in providing a response in DRC because it would confirm its presence, even though it has been established. And on the other side, the M23 is ill-equipped, unable, and unfit to run a catastrophe response of this magnitude. We need to have the experts on the ground, and these are international experts as well as Congolese experts. The Congolese government must return to Goma and Bukavu.
U.S. aid to the DRC dropped from nearly $1.2 billion in fiscal year 2024 to just $67 million by late 2025, a collapse in funding that aid workers say left your country dangerously exposed ahead of this outbreak. Washington simultaneously, as you well know, withdrew funding from the WHO, dissolved USAID, and cut support for the CDC, the very institutions needed to detect and contain outbreaks like this one. One could easily argue the U.S. is both your security partner and the architect of the conditions that made this crisis worse. How do you reconcile that?
Right now, we're focusing on getting through this crisis. I think this is the most important part. The U.S. is a sovereign country. I think the decisions that they took to withdraw funding were not specific to the DRC. I think they withdrew funding from a number of places. So we do not perceive this as a specific act against the DRC. Of course, the repercussions were felt, but at the same time, we are very satisfied with the fact that the United States of America have stepped up very rapidly as soon as the epidemic was declared. I think there will be lessons that will have to be drawn from this experience, obviously, on our side, on the side of the Congolese government, on the side of our partners, and how we see our partnerships evolving. I think this is completely legitimate, but the priority right now ought to be, how do we weather this storm? How do we overcome this epidemic? And in the future, how do we prevent this from happening again?
Understood. Minister, the UN warns that more than 4 million people in the DRC risk being deprived of all humanitarian aid, and the World Food Program has dramatically cut its planned assistance to your country due to funding gaps. This was before the Ebola outbreak. I wonder, do you believe the international community is retreating from the DRC? And what is your government itself doing with its own resources to ensure the country's survival doesn't depend on the outside world?
I think that's the first point we need to be focusing on. How do we further greater self-reliance? How do we further greater capacity to cover our own needs at the level of the Congolese government. And I think President Tshisekedi has been very resolute about this. It's been going hand in hand with investing more in local services and making sure that basic services are provided to our communities. Also investing more in sectors that have been unfortunately neglected for decades, such as agriculture. I think this is the first step in order to cover issues such as food security. And so we see very important investments and efforts being targeted or channeled towards these areas that have been neglected for decades. Obviously, they will not materialize immediately. So these are works in progress, and we hope that in the middle term we will have already first results that will help us stabilize the situation and reduce our reliance on outside assistance and aid.
DRC Foreign Minister Therese Kayikwamba, Wagner. Thank you.
All right, let's get more from Dr. Jean Kaseya, Director General, Africa Centers for Disease Control and Prevention. Hello and welcome to the program, sir. So Africa CDC has declared this Ebola outbreak a public health emergency of continental security. More than 100 people have died, hundreds more suspected cases. How serious really is this outbreak?
This outbreak is so serious because we see in a few days, we moved from 40 deaths that were reported to 116. And we are talking about 4 to 5 days. And we also know that what we have is underestimated because we are waiting for the outcome of the active surveillance that we are conducting now. We decided to declare this outbreak public health emergency of continental security because we know when there is an outbreak in more than one country, we call a committee of experts, the emergency consultative group, where African experts are sitting to analyze data and to provide recommendation to the Director General of Africa CDC if we can declare this outbreak public health emergency of continental security. Then we start to conduct the political process, calling the president of the Burundi, who's the AU chair, calling President Ramaphosa, who's the AU champion for pandemic prevention and response, and calling the African Union chairperson. This is the process that led to declare the public health emergency of continental security.
Right. I mean, it really does sound serious how you're putting it. And the World Health Organization believes that this outbreak is going to further increase. I mean, they expect more infections coming up. But they also say this may have been spreading for weeks, possibly even months before it was detected. With the outbreak in West Africa, I remember 10 years ago, that was a long delay, a month, right? It led to the biggest Ebola outbreak in history. Could that happen again this time, you think?
Look, we are conducting studies to better know this virus. My experience now dealing with outbreaks, I take each outbreak seriously. And I don't speculate around the outbreak if it's less or more serious. I just take it seriously. What we know, for the time that it was declared, and as you know, it's Africa CDC that declared that on the 15th of May, I made it because we saw that 2 countries were affected. In our protocol, when the outbreak is in more than one country, it becomes the mandate of Africa CDC. Even we don't have to wait for the national authorities to declare that. We declare that. And this is why we did it, and we are working. Now, I'm in DRC. Tomorrow, I'm flying to Uganda. And on Saturday, I'm calling for a cross-border meeting. DRC authorities and ministers, they will fly to Kampala. And I will bring also some other partners. Then we'll have one plan to respond to this outbreak.
Right. The current outbreak is linked to the rare Bundibugyo strain, for which there's still no approved vaccine or specific treatment. So what tools do you have to contain the outbreak?
Let me start by saying, when Africans are talking about inequitable way to deal with human beings. All of us, we are human beings. Because this outbreak was discovered in 2007, it means 19 years back. Now, let me say, if it was in Europe or it was in the US, now we could have already vaccines and medicines available. But because it was in Africa, there was no interest to develop this vaccine. Now we are taking this issue seriously. I called for a meeting of big pharma, of research and development companies. We are working together with WHO. We need, and we are having some candidate vaccine. We need to have vaccine by the end of this year. But for now, because we don't have vaccine, we don't have medicine, it's mostly what we call the public health measures that can help us to stop the transmission. It means the more detection. This is why we need more capacity. We need more $1 million to buy diagnostic capacity. We need to isolate those who are sick. We need to conduct dignified funerals. We need also to provide information for water and sanitation. And more importantly, we need to protect our health workers. These are a number of measures that we are putting in place to stop transmission of this disease.
Right. Look, I know this is not a pandemic yet, right? But there are people that are worried. Should people be worried about lockdowns, border closures, or is that not necessary in your opinion?
You know, every year, Africa CDC manage around more than 200 outbreaks in Africa. It takes our time, it makes us busy. And we have experience, we have people, we have the know-how, and we are clear. Stopping movement of people is not what we are recommending. Closing borders is not what we are recommending. I think they saw that Africa CDC released a press statement against the decision made by the US government to impose travel restrictions to DRC, to Uganda, and to South Sudan. Even what I don't understand, South Sudan, where we have 0 cases reported, why are they under travel restriction? These are some measures that we don't understand in Africa. No one can explain to me why.
What do you think?
I already said that in our statement. We say they have to lift this decision. What African countries they need today is how European countries, other Western countries, they can come to support us. The chairperson of African Union Commission wrote to all partners to come to support Africa, so this is to better support African countries. We are meeting on Saturday. By Sunday, we'll have a joint plan for all countries infected, but also countries at risk. Then we'll start to work with African countries, how much they can give to play solidarity, but also with our partners from Germany and others. It's time to apply solidarity. It's not time to punish, especially punishing countries that are applying transparency, because that one will backfire in the future. The lesson we are giving to this country is don't apply transparency when you have outbreak, because you'll be punished. This is what we don't want in Africa.
Right. So for those listening, especially people in the DRC, there definitely are concerns of the worst case scenario. So I want you to help talk to them. What can Congolese people and others that are affected by this do to protect themselves?
I'm saying to Congolese people, I'm like the general of army. I was in Geneva when this outbreak became a major public health issue. I stopped in one day my engagement. I came to fight with them. It means there is hope. We have experts. Yesterday, I was talking about Professor Muyembe, who was appointed special advisor to the Director General. It means we have experts who can help to fight that. This is the first reason to hope. The second one, we know the public health measures to be in place to stop the transmission. The third one, we have the willingness to provide funding from Africa and from our partners to fulfill our commitment. And the fourth one, we are conducting research and development to find very quickly, in a few months, medicines and vaccines. today, Congolese people, they must say, the Director General of Africa CDC told us the government of DRC is doing great job. The government of Uganda is doing great job. The situation can be controlled if all of us, we implement public health measures, as I said.
Right. A final one before you go. Look, we've been talking about Ebola outbreaks for a while. In the DRC, the people you just addressed, there's already been 17 different outbreaks. So it happens quite often. Can the continent prevent future Ebola outbreaks from becoming regional or continental health crisis? Are we just going to have to live with Ebola outbreaks in the near future?
Look, we had Ebola recently in DRC in a region called Bulape. It didn't spread across all other regions. Why? Because this strain called Zaire, we have vaccine, we have medicine. We managed to control that. The issue here, why do we have this Bundibugyo outbreak in Ituri spreading like that? First, because we are in an area where there is insecurity. But we have also density of population. It means the movement of population is huge. And it's also a mining region. It means people are coming to look for wealth there. These are all factors that are explaining the quick spread of this outbreak. We also have issue on detection. If we had early detection and we have a measure that can help, we have a way that we can report the result early to the capital, I think we could avoid the unnecessary deaths that we have. It means we have so many lessons by first implementing, making sure that people, they know, because they know symptoms, because we are in a region where we have regular outbreaks. Second, to make sure that we decentralize the laboratory network to detect quickly. And third, we put in place the digital system to send the report quickly. And also, we need to stop with the insecurity. That is a major factor of spreading outbreak.
Right. Thank you very much for that. Dr. Jean Kaseya, Director General, Africa Centers for Disease Control and Prevention. Thank you.
Thank you so much.
The situation in Eastern DRC shows just how closely conflict and public health are linked, doesn't it? And for those internally displaced by conflict, it's a big challenge.
With Ebola and the insecurity, our situation is really difficult. We're spending a lot of money. Our expenses have multiplied. Our situation has become difficult. We no longer have enough to eat. And our children have become street children. They have nowhere to live. Where we live, things are so complicated. Our houses are in terrible state. Our situation is very difficult.
We are asking for hand-washing kits. And above all, the most important thing here, what we are asking for is toilet maintenance. The toilets are already overflowing. There are rats running around in the toilets and getting into the pots. First and foremost, we are asking for help to empty our toilets. We are emptying them with our hands. This is essential to prevent this disease.
Have isolated cases of resistance. Nevertheless, most travelers understand and let us take their temperatures. We're asking the Congolese government to provide us with protective equipment. At the moment, we have nothing. We're making do with what we have. Sometimes we use a face mask for as long as 2 days.
We are dealing with a highly contagious Ebola virus. It spreads through contact with bodily fluids such as vomit, blood, or semen. Symptoms include fever, vomiting, diarrhea, and muscle pain. So watch out for all of those. Ultimately, ending this outbreak will require more than vaccines and treatments. Security, stability, and trust in public health systems are just as critical. That said, Congo has dealt with 17 previous Ebola outbreaks. So there is hope that its experience can help contain this one before it spreads further. What do you think? Share your thoughts with us on Facebook at DW Africa. Listen on Spotify or wherever you get your podcasts. And subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Isaac Mugabe. And I am Eddie Micah Jr. Thanks for listening.
DW. Made for minds.